Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Katrina Sanders. Katrina earned a master's in education and has held a faculty appointment in dental hygiene. She is also founder of Sanders Board Preparatory Program for Dental Hygiene students. Additionally, Katrina is a clinical dental hygienist, an author, and an award-winning speaker. And I've invited her here today to share more about her courses. So thank you so much, Katrina, for being here.
Thank you. I'm so honored to be here, Vanessa.
Could you start us out by telling us at a high level, you have 4 different courses, and so is there a unifying thread or theme that would help the meeting planner be able to start understanding more about your topic area focus?
Great question. I would say the unifying theme that pulls all 4 of these courses together is truly empowerment and inspiration for the dental provider. And I think throughout each of the courses, there are fresh and unique ways that I focus on being able to reignite that passion and joy that dental providers have for the beautiful work that they are called and compelled to do.
I love that. Now tell us a little more specifically about each course, the area of focus, and what's the problem that's happening for the dental professional, and how do you resolve it with that course?
So my first course is an infection control course. And of course, I would say the biggest problem there is that dental providers have to take infection control coursework in order to renew their licensure. So problem, we need to take infection control. Other problem, that's often a really dry course. And so one of the things that I love about being able to teach this course is that there's a different spin on what this infection control course delivers. I take course participants on a survey of infectious diseases through time, and we get to understand information about societal norms that have now changed the way that we integrate infection control procedures today. The course that I deliver on local anesthesia is an incredibly unique course for me in that I'm able to really deliver information about the clinical paradigm of local anesthetic delivery. It's a tough experience for the patient, right? You're going to give me that shot, and it can oftentimes be nerve-wracking for the dental provider. So one of the things that I focus on is being able to deliver information about anatomical considerations, physiologic considerations, things that dental providers need in order to be able to successfully deliver injections and be able to feel confident in delivering those injections. I also deliver coursework in the oral systemic link. Now, the oral systemic link, unless you've lived on Mars for the past decade, it's definitely out there. It is discussed in articles and literature all the time. And one of the challenges that we have as dental providers is how can we take this information that we value and bring it back to the patient? How can we change some of the protocols or paradigms that we are implementing currently so that our patients are able to value the care that they receive from us, but also to be able to improve their quality of life? Finally, I teach a course that takes periodontal diagnostics and coding and blends them all together and really provides the dental provider and the administrative staff with information on how an appropriate periodontal diagnosis helps to guide the decision-making process in identifying which code is appropriate for our patients and being able to appropriately address third-party payers. That's it. Those are all 4 of my courses, all working together to inspire and empower the dental provider.
Well, that's a wide range, but yet there is a unifying thread, and certainly all fall within a certain area of focus. Now, do you find that for most of your courses, are they well suited for the entire team or certain providers?
Fabulous question. Certainly the coursework that I teach, for example, on local anesthesia will be best appropriate for the dentist, the dental specialist, or the hygienist. However, I have had assistants come to my course because they have a really profound interest in anesthesia and they find it fascinating. I would say all of my courses in general are excellent for the entire dental team because part of us feeling inspired and empowered and being able to integrate passion is for the entire team to be working cohesively. So I love that my courses allow the dental team an opportunity to all be able to communicate effectively on how they can work together to appropriately integrate my deliverables into their practices.
I love that too. Now, another question for you. I understand you have a master's in education, which makes me make an assumption that you probably have a good understanding of adult learning techniques, which we know in our industry, meetings industry, how important that is for the student. Can you share with us how do you incorporate adult learning type techniques into your programs?
Fabulous question. My master's degree coursework focused on the affective domain. And the focus of the affective domain is essentially evaluating the values and belief systems. As dental providers, we struggle with that when we treatment plan things for our patients, and maybe they don't value the things that we shared, or they don't necessarily believe that they need the care that we've provided. So part of our job as dental providers is not just to lecture our patients, but also to find these unique ways to build that value. As an educator and dental provider, I focused heavily on what is it that I can do to build value in the participants of my course so that they walk away completely changing the way that they have conversations with their patients. So one of the things that I love about being able to teach coursework is when my participants go back into the operatory on Monday morning and they share with me, for whatever reason, after your course, it changed the way that I communicated with my patients. The way that I diagnosed and explained periodontal disease had a different spin on it. And because of that, my patients are accepting treatment. My patients are instilling change in what they're doing at home, or my team feels more cohesive because of that. And so being able to deliver that to me is so incredibly rewarding.
Oh, that's wonderful. Well, I thank you so much for sharing. Before we go, is there anything that we haven't talked about that would be important for the event planner to know about working with you or about your courses in general?
I would say that one of the things that is important to me as a speaker is not only to inspire and empower, but also to provide a fun environment. It's hard sometimes taking time out of the operatory, going to a CE course because you're required to, you're spending your Friday or your Saturday there. And I think that learning should be fun. I think that we should all have a great time. And so it's incredibly important to me that participants laugh and feel that they're a part of the conversation and can collaborate with each other and can create dialogue with each other. We spend so much time isolated in our operatories. So I love being able to bring people together through my coursework.
I love that too. You bring up a good point around the importance of that camaraderie. It's a real value in attending meetings live, right? It's one of those things that would help us in our industry to keep attendees coming. Is understanding that value of the relationship. Thank you so much for sharing with us, Katrina. You have really fascinating and interesting and important courses that you're offering, and thank you for bringing that to dental. And for the event planner who would like to find out more about Katrina's program. She does have much more detailed information about each of those. You can visit dentalspeakersbureau.com to learn more, and we'd be happy to connect you with Katrina. And so thanks again for tuning in, and until next time, be well, and we'll see you then.